One of the things that people talk about in our field is the experience of compassion fatigue. But neuroscience and functional MRI scanners are showing us that compassion can't fatigue. What we've experienced as compassion fatigue in the past is this state of affective empathy that we have saturated ourselves with. If you stop yourself from asking the question, what it would be like for me to be in their shoes, and move into cognitive empathy and then subsequently compassion, when you go to see the next patient, you're going through that whole process again, which again is outside your conscious control, and you're again stimulating these negative empathetic centers in the lower parts of the brain that will lead to emotional depletion. So most immersive physicians see roughly 20 patients per shift, maybe a little more, a little less. So each time that you have this experience of affective empathy, if you do nothing to move yourself out of this, by the end of the shift, your empathetic centers are completely overloaded and flooding your brain with negative neurotransmitters that lead to professional burnout through the experience of empathetic overload. It's not good. That's why 64% of physicians across all specialties are currently experiencing at least one symptom of burnout. So, on the other hand, inside the experience of compassion, with all these positive neurotransmitters flooding all these positive centers in our brain, everything that we are as a human being is augmented. Our physical strength gets better. Our immune system is recharged. Our spatial perception is better. Our ability to calculate is better. Our ability to make a diagnosis is better. It turns out that everything that we can do as a human is augmented, enhanced, or supercharged so that we can do more and be more, which is amazing in and of itself. So compassion can't fatigue. It's not possible. The more compassionate experiences we have, the more emotional reserve we create, the more resilient we become. It's a bit of a challenge, since we've always been taught that we can't connect and we can't feel our patients' pain, we can't get close to them, to overcome that training. But this can all happen without actually saying a word to our patient. We can move through these changes of moving through affective empathy to cognitive empathy and then compassion without verbally sharing the experience with the patient. We can even be doing the history and physical while we're moving through these processes in our own mind. And that is why mindfulness training is so effective at reducing burnout in physicians and other healthcare providers. The techniques of mindfulness that allow us to become more compassionate people are the most effective at reducing burnout. Although this is the first time I'm talking to you about this, I'm really giving you the answer, or want to sort of plant the seed that the idea is that compassion is the holy grail in our ability to overcome the empathetic overload and professional burnout that we're all currently experiencing.